All right, everybody. Good evening. Welcome to PT and Pints. I hope you all have your favorite pint with you tonight. What we're going to do tonight is a lot of different things, but majority of the stuff is we really want to kind of disperse some information. We're going to give you a little history background of IRG and talk a little bit about kind of what you should be looking for as a person that just is graduating from PT school and looking for work. We want you all to ask questions. I'll get started with an introduction and I'll let Brad and Marty introduce themselves, but I'll start with myself. I'm Shannon O'Kelly. I'm a physical therapist. I'm the president and CEO of IRG. I've been a physical therapist for 35 years. So 35 years ago, believe it or not, I was sitting right where you're all at right now, kind of contemplating what is my first job? What am I going to go after? What am I interested in? How am I going to interview? What questions should I ask? So those are the kind of things we're hoping to help you with tonight. And they asked me what my favorite beer is. My non-craft beer, my favorite is Budweiser. I like Clydesdales and Dalmatians, So my favorite kind of craft beer is Scuttlebutts. And tonight I'm drinking a Scuttlebutt Porter. I like to drink my oatmeal, basically. And Scuttlebutts is a local distillery. They happen to be my neighbors. They're 2 houses down from me, so I get a good deal on Scuttlebutt beer. So and it's a good beer. And so they're right here they're in Everett. We're coming to you all tonight. I'm in Mill Creek, which is about 30 minutes north of downtown Seattle. So we're in the Puget Sound. I'll let Brad introduce himself, and then I'll let Marty introduce himself. Okay, Brad, go ahead.
Hey everyone, I'm Dr. Brad Defenbaugh. I'm a PT, board certified in sports, clinical specialist, and then also TPI certified. So my area of interest has been golf for the past 5 years at least, but avid golfer since I was 8. So I graduated about 12 years ago, and then became board certified about 2 years after that, and moved from Iowa to Washington State about 10 years ago, and been treating in outpatient orthopedics ever since. Favorite beer is kind of similar to Shannon. I go with the local I'm coming out of Sammamish, Issaquah area, so we have a local brewery called Formula Brewing, Czech Pilsner. So I can't quite go to the IPA hoppiness, so I'm staying on the lighter side of things. And then so today what I have is a Crux Pilsner.
Nice. And Brad is going to talk tonight about some of our technology platforms we're using, some of the things that he does in our onboarding department. Brad is instrumental in when we hire and bring new therapists on board to the organization. Brad is very involved in getting them adjusted, introducing them to our platforms, talking about technology, so he can answer any kind of technology questions and things you should maybe look for when you look at a company regarding technology, what their vision is, what their future is. Marty, why don't you take it from here?
Yeah, hi, I am Marty Roscoff. I am originally from upstate New York, but I live and work in the Seattle area. I graduated from the University of Washington in 2019, so I am kind of more on the recent graduate end of the spectrum, but I kind of aggressively pursued advanced training right after graduation. So I've done a residency and a fellowship through the Ola Grimsby Institute. And I would say I'm a little bit of the oddball in that I am not a beer person that much. I will drink it, but I don't have any at home. So instead I have a Sauv Blanc with me. Ooh. That's actually kind of cool.
A pint of wine. Good job, Marty. A pint of wine.
Exactly.
We are really excited to have Marty joining us tonight. Marty is one of those young therapists that just has so much motivation and dedication to the profession. He just mentioned he has done a residency and a fellowship since graduating in 2019. That's really impressive. Basically, he graduated and he's been participating in our mentorship program here at IRG for 2 years, over 2 years. So good work, Marty. A true leader in our young professional population. Really excited to have both Brad and Marty with us tonight. But before we get into the program, I think we should take an opportunity to make a toast to you all out there. It's PT and Pints tonight. So if you have your pint, grab it. If you have your wine, grab it. Maybe you have a gin and tonic, grab it. But I just want to say, hey, congratulations to you all. Welcome to the profession of physical therapy. A long road. It probably has felt like. I can't believe you all did it during COVID. I can't imagine some of the challenges, but your dedication, your efforts, your commitment are going to be rewarded. Trust me, you are entering in a profession that I can't imagine doing anything else in my life. I feel blessed to have found it, and it found me. You're going to be able to make changes on a daily basis. You're going to learn every day. You're going to grow as a professional, and you're going to affect people's lives. And I think that's what it's all about. So always keep up that passion and that commitment, and always continue to learn. And that's kind of what we're going to help you with tonight. So I'm going to take a drink here of my porter. I'm going to have to take another drink. And cheers to you all. Congratulations. I like to always say, I think Mark Twain said, what is your next choice? What is your career choice? Meaning, obviously, your career choice is physical therapy, but what clinical setting are you looking for? Where is your passion? Where is your interest? What sparks your interest? And if you can find that, and find a job that you like and you enjoy and you love, you really don't have to work a day in your life. And I always tell young therapists as I interview them, I've been doing this, like I said, 35 years. I've probably interviewed well over 1,500 applicants. And I always tell people, I want you to find somewhere, something that you get up every day, and every day you don't have to go to work, but you go to your passion place and you go to what excites you, and you bring energy and positivity. And that's really what the profession needs. Remember this, people. Everybody that's coming in to see you every day, generally speaking, is experiencing pain. And if you can bring that positive energy, that excitement, and that passion, that's going to help them. Because, if you can help someone in pain, decrease that pain 5% of decreasing pain is a lot of decrease. So always look for something that you're passionate about and you love going to work. I want you to be able to get up every day and like to go to work. Because if it's not called work, it's called vacation, and we get limited amount of that stuff, okay? So be passionate about what you do. Next slide, Jensen. Any questions, we can add them in the chat box. I'd love to answer questions. We have a small group tonight. It's very informal. I'd love to look at some questions that I can answer. Let me get a little history of IRG Physical Hand Therapy. Like I said, we've been at this about 26 years. I've been doing this since 1988. I opened my first practice, but I established this company we call IRG in 1996. I established it based on the need to really grow and become regionalized. In the mid-90s, they were talking a lot about managed care. So the idea is that you had multiple locations, multiple regional locations, you could participate on these managed care panels. And I've always liked to grow. When I was in PT school, I knew when I was in PT school, I was going into private practice. I knew I was going to grow, and I knew that's what I wanted to do. Over the years, we've been diversified. We added hand therapy in 2000. So most of our hand therapies are OTs that actually have their CHTs. And during that time period, we've added a very diverse service platform. We do everything from lymphedema, vestibular, fall, balance, manual therapy, sports medicine, functional movement. You name it, we probably do it. We just recently acquired a pediatric facility where we do pediatric PT, OT, and speech. We like to say we have you covered. That allows us to cover the continuum of care from pediatrics to geriatrics. I'm a big believer that as young physical therapists, I want you all to start thinking about, you want to be the family's physical therapist. I think that's important, that we're the family physical therapist. It's interesting that physical therapy as a profession doesn't really have an identity from that standpoint. It's interesting that people go to physical therapy. They don't go to see Shannon, my family physical therapist. And we want to create that family environment. Not only do we want to be your family physical therapist, we also want to be your neighborhood physical therapist. So, we've grown over the years. We have several locations. I always like to tell people, we might have a lot of dots on the map. We are small in service. We are small in service. And what that means for me and our organization, our vision, we are going after the soft skills. And the soft skills in healthcare I think are important to kind of keep on the forefront. The soft skills are listening, building relationships with each other, and building relationships with our team and our community. I want to talk about in 2009, I got talked into partnering with a large national company. It's something that, looking back, that was 12, 13 years ago. I probably wasn't ready to do that. I got talked into it. But the good news is I was able to buy back and become independent in 2019. So we are 100% locally owned and operated, which is huge for us. So we make all the decisions right here in the Puget Sound. So we have a multifaceted service platform. Our therapists are all encouraged to pursue things like Marty is doing, specializations, certifications. We have an enhanced, what we call enhanced continuing education program. Not only do our therapists get $1,500 of Con Ed per year, but we also encourage them to go after certifications. It's actually expected. So when you're with our organization for 1 or 2 years, we expect you to become a clinical instructor. We also expect you to be in some kind of certification program. And what enhanced Con Ed means is we pay for that. So we will pay for you to participate like Marty did. He can talk about it a little while later, in a fellowship or residency program, or Brad is board certified. I think Brad is board certified OCS. So we pay for that, and we subsidize that and pay for that and support that. Okay. And in addition to that, we allow our therapists to mentor with other providers. We make sure there's one-on-one opportunities. So mentorship and growth is important, not just for our clinicians, but we believe in professional and personal growth for everybody in the organization. Any questions so far? Awesome. Anybody want to come up for air and take a sip? I'll take a sip. Yeah, every time I say physical therapy, you have to drink. How about that? Okay, you want to do that? Okay, maybe not. Next slide. All right. So a company snapshot. We're going on about 400 employees. We have about we're getting close to 40 clinics. We go from, if you know anything about the Puget Sound, it's a beautiful place. I've been here for 35 years. I thought I was going to be here 2 years. I can't leave it. It's got the Cascades, Rainier, the Olympics, the Puget Sound, snow skiing, you name it, it has it. But we go from way up north all the way down south. I mentioned that it's important to understand we are not a corporation, people. I want everybody to understand that I am not a corporation. That's not what I want to be. We want to be a group of partners and associates that are changing lives and making a difference in everybody's lives. Again, our patients, our team, and our community. We're probably doing, approaching 350,000 visits over the last 25 years of just touching people's lives. Okay, so I'm open for any questions. Can someone tell me what mountain that is on that slide right there? Can someone put in the chat? How about we play a game? Put in the chat box. If you get it right, you get to drink your beer. Okay. So that is, anybody know? Is there a chat there? Anybody want to? Yeah, that's right.
We got a Rainier.
From Julia Rainier. That's right. Good call. Julia, are you familiar with the Puget Sound? I mean,
yeah, I grew up in Issaquah, so.
Oh, perfect. Yeah. All right. Homegirl. There you go. Yeah. Homegrown. That's right. That's Mount Rainier. So again, I mentioned, just to kind of talk about again, how important it is that, everybody understands we're independently owned and operated. Let's see, from Dawson, your reward can be a Rainier beer. Hey, that's awesome. That's great. Rainier beer. Does anybody remember Rainier beer? You guys remember that? Remember those commercials? They were great. When I was in college, way back when, Rainier was the beer to drink. Okay. So that's how old I am. Okay. So, again, independently owned and operated. I'm so proud of this, and I'm so proud of this organization. Our strength is our people. Our strength is our people. We have fantastic people. And for us to be 100% locally owned and operated, we make decisions within 20 minutes. We make decisions within 5 minutes. We make decisions right here with our team based on what's going on in the Puget Sound. We are not, pigeonholed by unnecessary regulatory corporate structure. We want, here's the deal, people. Remember this. We did this because at IRG, we want to treat people, not paper. Okay. Remember that. We want to treat people, not paper. The reason you're all sitting there and the reason you just worked for 7 years of education, because your vision is you're going to go out and you're going to help and you're going to take care of people. And we want you to be able to do that. So we want to focus on what matters. And what matters to us is, again, building relationships. teaching, instructing the soft skills, going towards the light. We're super excited about what the future looks like. These folks that work at IRG are phenomenal. We are not bouncing back during this pandemic. We are bouncing forward. We're not bouncing back. We are bouncing forward. So we're excited about the future. Next slide. Any questions? Any chat? Did I miss anything? All right, good. So again, I talked about our focus, the 3 spheres we feel like we can influence. Let's talk about this for a minute. I want you guys and gals, folks, people, as you come out of school, I want you to understand the value, the credibility, and the professionalism you have. And if you look at our 3 spheres of influence, obviously, we believe in a very strong team here. I mean, that means that an exercise tech, it can help, and sometimes has great ideas. And the ideas and the collaboration with the team, it's all about the patient. Our patients are super important. We know our patients, when they experience our treatment and our organization, they become ambassadors and they become patients for life. A lot of our business is returning patients because our patients have such a great experience. We know that because we do surveys, we do NPS scores, we do outcomes, we know what we do. But what we really want to talk about right now in the future for physical therapy is community. At IRG, over the last 6 or 7 years, we've been working on a paradigm shift. Our shift is to shift more in direct-to-consumer marketing and direct access. In the state of Washington, we are one of 39 states in the country that has direct access. That's so important we understand that. You're now coming out of school, we're going to address you and we're going to call you a doctor of physical therapy. That means you have the ability to assess and treat everybody off the street. You need to be able to identify, is there a red flag? Is there a cardinal sign here? Is there something I need to know that refers this to a physician for diagnosis? Direct access is a game changer. We are trying to position physical therapy as the primary care providers for musculoskeletal injuries. And there's no reason why we shouldn't be there, okay? We should be in the forefront of MSK. And that's what our goal and that's our vision at IRG is going direct to the consumer, teaching and instructing and creating credibility and value for the profession. Okay. How about a toast? How about if we drink to that? Huh? PTs. I like to say PT, it's good for you, it's good for me. PT, okay? All right. Perfect. Next slide, Jensen. So the 3 pillars of care that we focus on, that we believe in, is we need to have high value manual therapy techniques. One of our values here at IRG is accountability. You need to be accountability to the profession, your team, and your patient. And even, it doesn't matter where you go work, but we have to be accountable. We have to look at outcomes. We have to look at evidence. We have to understand, what are we doing? Why are we doing it? And how can we create value? And again, credibility for the profession. So high value manual therapy techniques that create results. Functional exercise and movement, robust exercise program and movements, prescription, exercise movement is a huge kind of a pillar for us. But more importantly, right now, we are moving into what we consider a very important aspect. We're recording, everybody. Yeah, we're recording. That's awesome. But lifestyle medicine is so important. I've been looking at this for about 7 years, and I hope you all agree with this. It's important, particularly what this country and this world and society has just gone through is, a lot of struggles, a lot of anxiety, a lot of social unrest. It's just been crazy. I can't believe you guys went to PT school during this time. I mean, again, big ups to y'all. That's amazing. But we need to focus on lifestyle medicine. What that means is we need to talk to our patients about how are they living, what's their nutrition, how are they sleeping. It's okay to talk about mindfulness, gratitude. I mean, a lot of what you're going to do out there as you get into this world of physical therapy, sometimes those techniques are great, but a lot of times it's listening. It's sitting down, listening, engaging, connecting, and building confidence with your patients. And sometimes the longest journey is 6 inches between the ears. And I'm telling you right now, welcome to the world of coaching, because as physical therapists, what you're going to become is a really good coach. And a good coach is a motivator. A good coach is listening. A good coach identifies what are my triggers with my players? What are my triggers with my patients? So it is an awesome profession. So lifestyle medicine, matter of fact, this Friday, we have a course here at IRG that is all on lifestyle medicine, how to incorporate lifestyle medicine into your clinical practice. Okay, any questions? All right, good deal. So the PT profession, I think one of the things that I've seen over the last 35 years, and one of the things I'm noticing is just like the orthopedic world, you do not see a young orthopedic surgeon coming out of residency today without having a specialization, right? And I think the PT profession is positioned, again, to be the leader in musculoskeletal injuries and disease and intervention. But I think what we're going to see is a lot more therapists, young therapists, looking for enhanced certification and training, residency, fellowship, specializations. That's why 15 years ago, we really started to kind of emphasize specializations. We want our therapists to have a great foundation, a very good foundation of practice, but also to be able to specialize in an area where they're passionate about and really become an expert in that area. I think what we're going to see in the future, it's going to be okay for physical therapists to refer to other therapists. You know, basically, I'm a good shoulder and knee therapist, but you know, you need to see my colleague. They're a really good cervical, and we know that, and we see that because we're collecting outcomes here. And you will see that a lot of practices that you end up in and go to, outcomes are going to be very important. We participate here at IRG in a program called MIPS. It's called the Medicare Incentive Payment System. And what it does is basically, as we look at our outcomes, we report those to Medicare. And if we're above the median or mean, we get credited. If we're below, we get debited. And we're playing that game. And we need to be good. We need to look at outcomes. And we need to understand our outcomes and what is the best intervention for the patient. Okay, any questions? Next slide. That's Jensen on the slides, by the way. Jensen's in the background on the slides. He's doing a great job. So obviously you probably looked around. There's all kinds of different PT positions out there. You know, you can do contract, PRN, travel, Luna. You know, those provide flexibility. You treat your own way, kind of see the world. There is physician-owned practices. I mean, an example in our area is Pro Alliance, but we see a lot of physician-owned practices. As a private practice owner, I have to be honest, I'm not really a fan of physicians owning physical therapy, but that's my focus because I'm in private practice. I would like them not to be in physical therapy and refer their patients to us. And we're seeing more and more of that. We're seeing more physician-owned practices getting out of physical therapy. And I think they're starting to realize I should be doing surgery. I really shouldn't be in physical therapy. Leave it to the physical therapist to own the physical therapy. They know what they're doing. So we're seeing that. Like I mentioned, there's a lot of corporate-owned businesses out there. It's bonus productivity-based. An example is ATI and Confluent. You know, nothing against large corporate-owned businesses. For me and IRG, for what I wanted to do, I just felt like we kind of were losing our way there as part of a bigger system where the focus was getting away from what I wanted to do, and that's the soft skills. There's a lot of virtual opportunities out there. There's a lot of practices that are going to telemedicine. You've probably heard of Hinge or Sword. We're doing a lot of telemedicine. We're doing a lot of virtual engagement as much as we can. So we're using technology as a platform to, again, increase our market penetration and give our patients and our community more options. Okay. So next slide. So you can work in a small clinic, you can work in a medium clinic, you can work in a large clinic, you know. And so at IRG, you know, we feel like we are focused and committed to flexibility and providing benefits in a number of different ways. So we have PRN therapists, we have contract therapists, we have full-time employees, part-time employees. We provide flexibility. We have a high earning potential with tangible, I mean, a lot of mentorship, virtual services. I believe in transparency. I've always been transparent and access to leadership. I mean, we want to engage with our entire organization. Everybody is part of the team. And we believe in collaboration. Collaboration is really the new wave in healthcare. It's really interesting. In my world, 35 years ago, I mean, you didn't have access to the orthopedic surgeons like you do now. And today we're collaborating with doctors where we're doing virtual presentations. We're part of the team. The respect and the credibility is improved immensely. I mean, I have doctors, young doctors that are calling us up now going, hey, I want to become part of your marketing program. I see IRG all over. How can you help me grow my business, right? And that's really cool that they're reaching out to us. We've done a lot of collaborative opportunities of teaching education, virtual education. So the world is changing a lot. We've learned a lot during COVID. We've been very innovative. That's always been our strength. And again, we're excited about what's going on in the future. It's been hard. It has been hard the last 2.5 years for everybody. But I've always said through adversity, comes strength, and the foundation and the challenges you have today builds your strength for tomorrow. And we are just getting ready to really open up and really blossom. And we feel like we're coming out of this pandemic, and we're pretty excited about the future. And again, I just want to congratulate you all for coming into this profession, this great profession. I think Marty's going to talk about some mentorship now for a few minutes. Does anybody have any questions? Perfect.
Okay, so I want to talk about advanced training and mentorship because this is something that I wish had been talked about a little bit more as I was graduating. I think PT school does a really nice job of kind of getting you to that entry level position, and then they don't give you much beyond that. So advanced training is something that has been important to me. I had a really impactful third clinical rotation where I was at MTI Physical Therapy, where the requirement to work there is that physical therapists undergo a minimum of a residency. And so my clinical instructors were both fellows. And to me, I saw the difference that it made with that advanced training, which is why I went down the rabbit hole. But I just want to talk a little bit about the different ways that you can do advanced training. So starting with just weekend courses, or MedBridge has a lot of programs. I think that would be a great option if you don't totally know what road you want to go down and you want to explore and see what's out there. It's not a huge commitment, but I think the downside of it is you are kind of piecemealing something together. You're not coming out necessarily with a skill set, but rather kind of information here and there. The next level from that would be a certification program. So this is typically around like a minimum of a 75-hour commitment. Sometimes it is like a few weekends throughout the year. I have a friend who did a program to become a lymphedema therapist that was like an intensive 2-week program. Again, this can be a nice way to start to build up a skill set, but I think that if you know that you want to go down into orthopedics, considering doing residency and potentially fellowship would be good options. They are intense though. So residencies, that is going to be a minimum of a 10-month commitment. And I believe it is the minimum for a residency program is 1,800 hours of education. I think it's 300 of that. It has to be didactic, and then the remaining 1,500 can be like working. But then 150 of that has to be one-on-one mentoring with somebody who has advanced training. Then from there, you can move on to a fellowship. So a fellowship is, in order to pursue a fellowship, you either have to have done a residency program or you have to have a board certification, are kind of the two entry points for that. Again, it's a lot of work. And kind of, I think, not to skip out of board certified specialties, we'll get to that, but when you're deciding what you want to do, you have to think about what do you want out of it. A big part of that is time commitment, money commitment. So one of the cool things about IRG is they paid for all my advanced training, which on paper was for residency and fellowship, $20,000, which is a lot. You're coming out with a lot of debt from school already. And so that can be kind of a barrier to entry. And so finding a clinic or a company that's willing to work with you to help you figure out how to finance that can be really valuable. As far as what you're looking to get out of it, for me, I wanted a robust set of tools for diagnosis and treatment. And so I, again, knew that's what I wanted going in. But if you're somebody who's kind of on the fence, maybe starting with a weekend course that is like, a shoulder course or a cervical course to get kind of a taste for what other tools are there. Is this something that like I would want to go into a little bit more intensely? And then independent learner versus classroom learner. So there's different flavors of residencies where some of it is going to be more of a academic residency. So the University of Washington, for example, has an orthopedic residency that is going to look a little bit more academic in the sense that you are also TAing, and there's a lot of journal club requirements. I did a residency through the Ola Grimsby Institute, which before I was a physical therapist, I was in the chemistry world, and we would talk about going into academia versus going into industry. And the OGI residency and fellowship felt more like I was in industry. It was very much I'm working, learning on the job. It's just things to consider when you are looking through the list of programs. It's the best way to choose a program is to talk to people who have gone through it. You should be, if you're interested in these programs, you should be selecting a program based on the graduates that the program produces. Jumping back up to the board certified specialties. So this is a little bit of a different path that might be better suited to people who are more independent learners, in the sense that you do not have to be in the classroom for this. For the board certified specialties, you're looking at a minimum of, in order to take the exam, you, for all of them, have to either do 2,000 hours of work in the relevant field. So OCS would be orthopedics, SCS is sports, PCS, pediatrics, neuro, oncology, et cetera. So you either have to do 2,000 hours or you have to do a residency. Some of the specialties have additional requirements. So OCS, you can just do 2,000 hours and then take the exam. The sports certification, you have to also do, I think it's like 100 hours of field coverage, and you have to take a kind of like a emergency medicine course for sideline coverage. For the WCS, the women's health, you have to submit a case study. So these things can be great in the sense that you are setting aside usually about 3 months to study this material kind of intensely. So if you're more of that independent learner, that would be great. But the downside is you're not really getting the collaborative aspect of doing a residency or a fellowship. And you're also not getting to necessarily work on any hands-on skills. I think that would be one of the things that's lacking. Is for the residency and the fellowship route, there's a lot of emphasis on developing hands-on skills. And in order to complete those programs, you have to test out. There is a written exam, and then there is a oral and practical exam required to kind of finish those programs. So when you're looking at all of this, you kind of just have to decide, what do I want? And if you don't know right now, that's okay. You do not have to do these things right out of the gate. I did because I knew that's what I wanted, but you can take a year or 2 or 3 or 5 or 10. One of my mentors through the Ola Grimsby Institute was a full-fledged PT who had been working for many years before she decided to go back and go down this rabbit hole. So don't feel pressured to do it right away, but do know that it is worth putting the time into thinking about. Next slide. So mentorship, this is another thing that I wanted to talk about because I got a little shook by one of my interviews coming out of PT school. And what I mean by that is mentorship is something that I think when you're interviewing at a company, everybody is interested in, well, I want mentorship. Or not everybody, most new grads want mentorship, but it almost becomes a buzzword rather than knowing what you actually want. And so I was interviewing with a woman and I mentioned that, like, I'm hoping for mentorship. And she said, okay, what do you mean by that? What specifically do you want? And I was a little taken aback because beyond the term mentorship, I hadn't really thought about it. And so if you're going into interviews and you're asking about mentorship, you should first have an idea, what do you want specifically from this clinic? What are you looking for? Are you looking for somebody to discuss patient cases with in between patients? Are you looking for somebody who's willing to set aside their time and go through techniques with you? Are you looking for somebody to come in and kind of co-treat with you so you can learn from them? Or are you looking to kind of jump in with them on one of their patients? There's no right or wrong answer, but I think that it really is something that if you're asking for mentorship, you should ask yourself, what specifically am I looking for out of this? And then being realistic with your expectations. All I mean by that is you can ask for whatever you want, but know that different clinics and different companies have different resources. And so if you're interviewing with a boutique clinic that does 1 hour long one-on-one sessions and they only have one site, you're probably not going to have as much flexibility with what you are asking for because they have more limited resources. Whereas a company that has 10 or 20 or 50 clinics or hospital systems even have more robust resources to work with. And so they might be more ready to accommodate what you're looking for. And so if you're somebody who is seeking out a lot of mentorship, that should be something that you're considering is the clinic that I'm interviewing with, because they're interviewing you, but you're also interviewing them. Are they going to be able to support you in the ways that you need? With IRG, they have done a really phenomenal job so IRG is the first job that I took since graduation, but I, through school, interned at like 3 different outpatient places. And I think IRG has done a really nice job with mentorship. So when I started with the company, I was assigned a mentor right away who was outside of my clinic. And I liked that because it was an opportunity that if I was having any issues within my clinic, there was somebody outside that I could go to, which I thought was cool. I also, when I was interviewing with my clinic director, talked with her about mentorship, and I was pretty clear about what I wanted. And she was used to taking new graduates. And so she was like, I am happy to set aside, 1 lunch break a week to meet with you to go over whatever it is that you're looking for. And the more I worked with her, the more that we kind of spaced those out as I kind of figured out what I needed. And then I started the residency program, kind of got what I wanted out of that. Other things that I think are cool with IRG. So we host continuing education courses. So we're bringing people in somewhere between like 5 to 7 Con Ed courses per year, which again, if you're at a smaller clinic, might not be able to do something like that, but then a bigger hospital is going to be able to do something like that. The enhanced continuing education budget was how I financed my residency and fellowship. So that was, they covered the cost of it, and I just have to work years to kind of pay that off. And if I were to leave before then, I would just cover whatever wasn't paid off. And then other things that I think are just kind of cool. So we use Teams a lot. And there's like 35 clinics. So there's a lot of us. And I thought what was really cool is there was a clinic up north that was doing a wheelchair training with somebody, and they were not super familiar with that. And so they were able to post on Teams if anybody else had more experience. And I think that connection was really invaluable. Other things that I think are cool that are not listed. So IRG has also partnered up with Swedish with their family medicine residency. And so this is actually, now that I've done the advanced training, I get to mentor family medicine residents who do not have as much experience with the musculoskeletal system. So it's just a really nice way to get involved. I think that's all I'm going to say, other than I think one of the questions that I had when I was graduating about advanced training is, does it make a difference with respect to pay or other things like that? Because you're trying to decide if first of all, if that's your reason for doing it, that is the wrong reason for doing it. But with that, yeah, you get paid slightly more, but not enough where it's worth giving up 2 years of your life. I think more so what it does open up is leadership opportunities. So if you want to be noticed by whoever you're working for, I think that is more so what you're going to get out of it versus financial compensation.
Wow, yeah. Thanks, Marty. That's
Yep.
awesome. Any questions for Marty? This is the time. Obviously, you can see the guy is, just an amazing young therapist, has taken an opportunity to enhance his professional training and works hard at it. And any questions for Marty? No? I will tell you. Go ahead. Yeah, good.
Sorry.
No,
I actually have two questions, Marty. So my first question is, do you feel like there was a benefit to starting your residency pretty quickly after graduating? Like I like doing that versus waiting till you've like solidified how you practice. And then my other question is, what does doing a residency like this kind of hybrid thing while working, like, are you working full time and doing all this stuff on top, or do your hours get cut back?
Good questions. So I chose to do it right after PT school because I wanted the momentum to carry me, to be honest with you. I think that it can be kind of challenging to as a student, you're used to giving up your nights and weekends for school. And so I think that I worked for like 6 months before residency started, something like that. And I think there is benefit in going right into it just because you're already in the academic mindset. But I would argue as a counterpoint that having a year or two under your belt will really help you appreciate the material because you will be more aware of what your gaps in knowledge are and where your limitations are. And like I said, with my fellowship class recently, one of the people in it did a residency 10 years prior to starting the fellowship. And so there can be a lot of benefit to waiting. I just personally, with my lifestyle, I was like, let me just get it done now. And then what does it look like? It's intense. So I did not cut back on hours. I worked 40 hours a week. And on top of that, I did weekend classes. So it was Saturday, Sunday, 8 to 5. It was a little bit more than one weekend a month. I want to say we had like 14 classes for residency in a 10-month period. And then it was 12. And when I say classes, I mean the full weekend, 14 weekends for residency and 12 weekends for fellowship. And then you also have testing and studying. And then there's the 150 hours of one-to-one mentoring that you have to do. And that's 150 for residency and 150 for fellowship. And so that is the way that I did it with IRG is that was outside of my 40-hour work week. There are clinics like MTI, for example, that they kind of structure the residency where you kind of build that into your work week. But the downside of that is they get paid a whole lot less. And I was making a, full-time salaried PT rate in addition to having it paid for. So there's pros and cons. I'm going to be honest with you, it was a lot of work. Like if you're considering doing it, yes, it's a lot of work, but also I feel so much stronger as a clinician because of it. It was, to me, worth it.
Yeah. Yeah, Marty, I mean, good points. I mean, what Marty mentions there, what we do at IRG, is we pay our people that are in a residency fellowship their full salary, whereas other places you're going to get a discounted salary, but they'll give you time. We do try to cut out some time and try to make some time for people to study because we do appreciate the fact that it is intense and it is a commitment. I will tell you all that if you can get some advanced certification early on in your career, whether it's the board certifications, the residency fellowship, what we do see in our outcomes is improved outcomes based on enhanced certification. We see way better clinical judgment and clinical reasoning to those therapists that take advantage of early enhanced certification. So your outcomes, like Marty said, you become a better clinician. You definitely do. You're making better judgments, early clinical reasoning, changing courses, changing treatment courses based on your experience. So good stuff. Any other questions for Marty? Marty, you're awesome. Even though you're drinking wine, everybody else is drinking beer. You're awesome, man. Yeah. So, yeah, that's good. Brad is going to talk about technology and some of the things you should look at from a technology standpoint, kind of what's out there. Technology is moving pretty fast. So go ahead, Brad.
Yeah, I'd just like to chime in with the SCS part of it. I really didn't have the opportunity to do a residency in sports. There was maybe like 2 residency programs. So it was pretty early on when I got my residency or my board certification, but everything that Marty said is absolutely accurate with my feel of the residency versus just kind of studying for the board certification, taking the test. I didn't really find as much benefit from the certification as it was studying for the test. And I think Marty was being a little generous or maybe a little bit slow, but you do have those 2 years after school that you need to get all of your hours before you take the test. So I was essentially clinically studying for 2 years. I was didactically studying for probably a year of that. And I also had the good fortune to have the clinic that I was working at run a residency. So the SCS is kind of a blend of OCS and sports as well. So I feel like I saw everything going on around me. And if I were to do it again, I would probably do the residency as opposed to just doing the SCS. Kind of in a roundabout way, I did get the benefit of a little bit of residency mindset just due to the nature of people around me, but studying for the test, taking the test, really having to know the information was the biggest benefit, and it definitely helped me in my decision-making processes for sure. So that being said, now I'm switching over to the technology side of things and kind of my transition from clinical care into a little bit more of the role that I've taken on. I've always had an interest in technology. IRG is one of those companies that really, if you have a vision or you have something that you think the profession of physical therapy needs, or other people around you, or make their life easier, they're all for it. You just provide a plan and they'll help implement it. So through innovation, I think IRG is probably a little bit ahead of the curve on some of these things. I'm just going to touch on a couple areas that have developed over the past year or so that really kind of fast track some of the healthcare technology side of things. So previous to COVID and all the work from home, stay at home, we had to kind of be a little bit more innovative, and healthcare actually just had to catch up with what everyone else was already doing. So with everyone having a smartphone, you can really get whatever answer you want within a few clicks, right? So if you have a question about your back or your hip or your knee, like, your expectation as a patient is that I'm going to be able to find my answer very quickly. So over the past year, kind of the changes for the patients, they can get access to their records or even their physicians through a chat function in their patient portals now very easily, whereas previously the portals were not user-friendly at all. So that's quite a bit easier. Telemedicine that was maybe concierge physicians were using it. Now it's a staple in most physician practices, and physical therapists are very good at the soft skills, like Shannon was saying, lifestyle medicine. So we took that on as well as kind of just another avenue to talk to patients that aren't able to come into the clinic for whatever reason, whether it's they don't have the mobility to get in, or they just happen to be sick on a particular week. We use telemedicine to almost enhance what we're doing in the clinic. And then online scheduling as well. That's one thing that I'm a strong proponent of, just from a standpoint of I'm the person that if I'm working 8 to 5 and then I have to call someplace that closes at 7, I have a hard time doing that and a hard time leaving messages. So online scheduling just allows patients to give whatever information that they want, know what sort of availability each clinic has, and schedule with a therapist that's right for them. So that's the changes for the patient. The changes for us as PTs, the documentation process has gotten significantly better. Documentation is always going to be one of those things that we hate doing, but when we transitioned to our newest documentation software, it was just so much better from a frustration standpoint. Things were a lot smoother. There was a lot of things that were automated, and we were able to do that. So in the context of when you're interviewing at different clinics, my question straight out of the gate would be, how old is your documentation system and what do you use? Because if you've been to internships with the hospital, they typically use Epic. If you're at an outpatient orthopedic clinic, it may be one of those more legacy type programs, and we all have used those that are just painfully slow, and imagine doing that for day in, day out for years on end. So you're really kind of deciding the environment you want to work in, and unfortunately documentation is a large part of what we do. Clinical collaboration has kind of taken a different face from a standpoint of, you used to have to match up your lunch hours or match up times that would fit with a couple other people in the clinic, or maybe you pick up the phone and call another clinic, but that would take figuring out someone else's schedule. At least with our EMR, we can see everyone's schedule, or we can find out when people have availability. And since we do all use Teams, we have the kind of on-demand questions where we can find a specialist in a given area, ask a question, and then we get a response whenever they're done with patients or when the other therapist has time. Or you can do a video chat, and that's becoming more and more common for clinical collaboration. So it's just really a good path that physical therapists are taking now to get the best result for the patient, because we all know that we're not a specialist in every area, but if you have enough contacts, you know someone that's a specialist in that area. So you can steal as many exercises or as many processes that you want from other people. And that's where the crowdsourcing treatment approaches comes in. Marty mentioned the wheelchair situation where someone wasn't an expert. What he didn't mention was there were probably maybe 10 to 20 back and forth of, hey, can we figure this out? Just giving ideas back and forth. And it ended up being, you know what, I think I'd be the best person to handle this patient. Well, let me know their name. I'll reach out to them and I'll tell them what they need to know, and I'll get them scheduled. So again, that's a lot of background information and touch points that the end result is excellent care for that patient, which is always our goal. And then now we're getting reimbursement for some of our management services and keeping in touch with patients. So that's a benefit for us as PTs. Okay, next, Jensen. So here are a list of a couple of the different programs we use. Our EMR is Insight EMR or Insight Go. It's a browser-based program. You can get on at the clinic, you can get on at home. Very dynamic, very user-friendly, and a lot of automation to it. Our home exercise program is through WebPT, and then we keep in touch with patients through WebPT Reach. We take in outcomes for every patient that we see for the primary reason of the Medicare performance classifications, but we also take it as information that we can utilize for our continuing ed programs, mentorship, and I'll kind of get to that a little bit later. We have the ability to text our patients, because when we all kind of know if we get a voicemail from a number that we don't know, we probably won't listen to it. But if we get a text, then we're at least going to read a couple of the words. And if it comes from IRG, then you'll be able to understand, oh, okay, this someone remind me about something. Internal communication, like I said, is Teams, and our online scheduling is Better Access. Okay, next. Okay, so the data-driven mentorship and learning opportunities. So this is something that has kind of developed organically, just because we have so much data from so many clinics. We, in the past, have had to look at national norms, but like Shannon was saying, we like to compare ourselves around the Puget Sound. So we are very community-based, so we want to know what's going to be best for the community that we're in. So we look at ourselves as far as the outcomes of our patients, pain scales, things like that, put it all together, and we can determine, okay, this therapist is excellent at shoulders or necks or something like that, or this patient or this therapist needs a little bit of help on knees. Hey, here's an idea. Maybe we match the person that needs a little bit of help with knees with someone that's really, really good with knees, or someone that's really, really good with the shoulder or neck. Maybe we should match that up with another provider that's not as good. And then globally, you can use that to determine where a continuing education dollar should be spent. So not necessarily from a therapist to therapist standpoint, but from a company-wide standpoint. If everyone has just a same general understanding and same minimum threshold, then we're all going to be better off for that. So something that you'll hear when you're going to an interview is, oh yeah, we take outcomes from all of our patients. That's super easy. You just have a platform that someone fills out a survey. Everyone should be doing that. We compare against national norms or company norms. Again, the platform is going to do it for them. Clinic directors give the data to all the providers. So they would just give you a number and say, all right, here's what it is. Okay, but IRG will actually take that data and explain it and put it to good use, as opposed to just sitting in your inbox and being just a number that is tracked and no actions taken on it. One thing that I do like to say is that as healthcare workers, we're kind of hardwired to help. So especially with IRG and the access to Teams, there's rarely a situation where if you post a question or have a clinical question or something that you want to run through with someone, that they won't reach out back and help. Everyone's there to help. Everyone wants the patients to get better. So Teams allows us to do that. And then we also use DocsMe to do our telehealth. Okay, Jensen. So that's just a quick summary of all the technology. I'm sure everyone can understand. I'm a big proponent of technology and using that to get better outcomes for patients, but I also see it as an avenue for therapists to be less stressed because they're not on an island anymore. They're not having to answer their own questions or look in an anatomy book for a clinical question. Everyone is kind of at your disposal. You just have to reach out.
Thank you, Brad. Any questions for Brad regarding technology and the role of technology in the future or currently in physical therapy, what to look for when you're out looking for jobs? Any questions? Anybody want to ask? If not, we'll move on.
I have a question.
Oh, go ahead. Yeah, good. Thank you.
I was just wondering, with the outcome measures, are those only about subjective outcome measures, or do they also take into account objective measurements that the clinician would import?
So the outcome tools are just all those standard outcome measures or functional outcome tools that are research-based. So like your DASH forms, your modified oswestry, all those sorts of things. Clinical directors will look at functional limitation goals and things like that and how those are progressing. But from a big data standpoint, the normative values on the outcome tools are kind of what you look for.
Okay, great. Thank you.
Great question. Any other questions? Good stuff. As I mentioned earlier, you know, the strength of our organization here is our people. And I hopefully you guys all see the quality people that we have here in people like Marty and Brad and everybody here at IRG. I mean, the stuff that these people are passionate about, what they're doing, it just impresses me every day. And the advancement and the credibility and the respect that this profession has gained in 35 years because of evidence and data and research and outcomes and being accountable for the treatment and be able to make a clinical change as you're progressing your patient. Maybe that treatment's not working. Understanding you got to make a clinical change early on and try something different versus just doing the same thing over and over. And that's what mentorship's all about. And we will connect you, align you, and help you with that. So let's talk about maybe some interview processes, okay? So I've been interviewing people for a long time. As I mentioned, I've been doing this 35 years. I'm a pretty informal guy. I'm more interested when that person comes in the room. I'm looking for people, right? This is a people business. I can teach you how to be a good clinician. I can provide mentorship to you, but I want someone who is outgoing, upbeat, positive energy, you know, and knows a little bit about the company. Maybe he's done some research and asked some good quality questions regarding IRG. I saw you, I looked at you folks on Facebook, or I looked on your website. I'm really impressed. Tell me about this program. Tell me about that program. Asking those good quality questions, understanding who you're talking to is important. I like questions about what is your care structure? How do you schedule? Tell us about your interventions with patients. What are you looking for? We talk about here at IRG, working to the top of your license, as a doctor of physical therapy. Questions: what is your company's vision? What are your values? What is your mission statement? Those kind of things. Asking those questions, being interested in the company, showing interest is huge for me as I talk to people. You know, I mean, you want to know how success is measured. You should ask that question. What is success? A lot of people out there right now, I find a lot of students are very concerned about production. And here at IRG, we're not so concerned about production. Obviously, we look at KPIs. You have to have a decent schedule, I should say, but we're more interested in your intervention. What are you doing to provide the care, the intervention? What are you doing for outcomes? Why are you doing it? What is the best result for the patient? What is the company doing for innovation? How are you being innovative is always a good question. When you're genuinely interested in the organization and ask those questions to prepare for your interview, it comes across that you've got good energy, so to speak. Okay. You know, a lot of young therapists today obviously are interested in work-life balance, flexibility, being creative with the hours. Ask about that. What are your hours? I mean, what do your clinic hours require? For us, it's different for every clinic that's out there. We have different hours in the majority of our clinics, but for the most part, we're open early in the morning, late at night. But a lot of our people work 4 10s or 3 long days and 2 short days, and we can be flexible and creative. I always like when a young candidate says, what is your vision? Tell me about your vision, Shannon. What is your vision? I interview all the PTs and OTs and all the clinical people that come into this organization, and I get a chance to talk to them. And when I get a chance to talk to them, I enjoy that they're interested in the organization. And what is my vision? What is our vision? How can we work that vision together? So being generally interested, positive energy, good question, that always goes a long way. Next slide. You know, stand out, have a growth mindset, show your interest and knowledge you get into practice, have thoughtful questions. And then it's always really impressive when the person I interview sends me a thank you note. That's very professional. It shows a lot of professionalism. It shows a lot of respect. It shows a lot of gratitude. And those are the soft things. I'm looking for the soft skills when I interview people, because again, I can always change and teach technology. I can teach clinical education. I can provide courses. Those soft skills, that humanness, that human side, that is the most important thing for me. And that makes the best therapist out there, when you can connect with each other and connect with your patients. So a quick thank you note. Thank you for your time is really important. So, just be prepared, ask questions, be enthusiastic, have positive energy, and you'll do great. So that's just little tidbits that I have to stand out. Any questions? Awesome. Well, I mean, it's 7:11 on the spot. If you have a question, there's our emails, or you can type in the chat. Did someone ask a question down here in the chat? I apologize, you've already mentioned this. Will you be sending out the recording for this meeting? Yes, we can. Yeah, we can do that. That's from Jennifer. Jensen, we can do that. This has been recorded, right? There it is. Thank you. There you go. Right there. How about that? Right on time. Good job, Jensen. I've got Jensen in the background running the PowerPoint. Any other questions? Thank you.
I have kind of a specific question that maybe you can't answer, but I'm curious because I am studying not inside Washington State. So I've just heard things as far as like, there's no dry needling in Washington, and like there's it's hard for PTs to do a lot of manips because that's the Kairos avenue. And so I was wondering, do you know how legislation's going as far as like PTs having that autonomy?
Yeah, the gentleman who's not able to be with us tonight, he's on vacation. He works for us. His name is Ben Boyle. Ben is our Chief Internal Affairs Officer. He happens to be the current PTWA president. So he's our current Washington State chapter president. He's also very involved in legislative. We've been working dry needling now for 3 or 4 years. We are encouraged because one of the legislators that has blocked it in the past is retiring next year. So we're encouraged that we're going to be able to get it through that process. As far as manipulation goes, Marty and Brad, and if anybody can jump in here, I think, we worked that deal out years ago with the chiropractors. They kind of put the kibosh on it for many years. And now we have it. I think you just have to have some credentialed, certified hours. But jump in here, guys, if you have any specifics on that question.
Yeah, Marty, do you want to take it or do you want me to?
Yeah, so spinal manipulation, the short answer is yes, we can do it. So I work at the IRG Ballard Clinic where we're all fellows. And so part of our advanced training is we've met the requirements, but basically it is, the chiropractors have lobbied to just make it harder for us to have access to, but you can do it in Washington State. You just have to have supervised practice. You have to undergo, you have to do radiology, you have to do differential diagnosis, a lot of stuff that coming out of PT school you have already covered. And so it's just a matter of in the state doing it under supervision of somebody who has the spinal manipulation endorsement to get the hours signed off on. And then you might have to do a radiology course if you didn't do it in PT school.
It can be done. We worked for 20 years to try to get spinal manipulation in the state of Washington, and we finally got it, but we got it with some strings attached from chiropractors. And Marty's exactly right. You can get it. You just have to go through a process. We have several therapists that have done SMT in the organization.
Yeah, and I would second that as somebody that didn't go through the fellowship, and I just have my certification. I really didn't do anything extra because mobilizations technically, in the eyes of the legislation, count for manipulation credit. So if you are treating in the clinic, then you're able to count those hours, and then everything from PT school carries over. So when I got my certification, it wasn't a big deal. Now you do need to have it under the supervision of someone who has advanced certification or the manipulation certification. But again, within IRG, we have quite a few.
And that's something we listen to our providers, and when our providers say, hey, we want to get spinal manipulation, we can bring courses in to help with that. Or we can make recommendations. For example, we have a lot of therapists that group up and they get together and they study as a group to do their OCS or NCS or NCS, whatever it might be. So we try to group them up because a team doing the same thing is much more powerful than just trying to commit to do it individually, right? So we really try to build mentorship groups. Good question, though. Good question. Any other questions? Yeah. Well, like I said, there you go. You can email us, you can contact us, you can ask, we'll get back to you. It was a pleasure. Again, I just want to say congratulations to you all. How many people are taking their boards next week? Majority of people are waiting for July to take them. No, okay, you'll do fine. You all do fine. It's just part of the process. So enjoy your evening. Thanks for sharing a beer with us.
Thanks, guys.
Thanks
Thank
for
you.
hosting.
Oh yeah, absolutely. I know.
Thank you.